All right, let's get started. So as you know, UNICEF's been supporting countries around the world to protect, promote, and support breastfeeding for decades. And now more than ever, our efforts with governments, with partners, with health professionals is more essential for achieving the rights of children to nutrition. There's unequivocal evidence that breastfeeding plays a crucial role in the health and development of infants and young children. And not only does it save lives, but we know that it ensures that children thrive. So why do infant food companies want to be your partner? As you know, the topic of today's discussion is looking at the health professionals' roles in protecting nutrition rights of mothers and babies. And what I wanted to just introduce the idea or the discussion is why the infant food companies want to partner with us as health professionals, with health organisations, and health agencies. They want to partner with us because they want to be accepted as a reputable company. Purchasing decisions, so us as consumers make purchasing decisions based on how a product or a service makes us feel. Linking brand names with reputable organisations buys the companies what we call sort of that halo of goodness and enhances their reputation. So this is achieved more cheaply, though, through partnerships than it is through, for example, just mass media campaigns alone. So companies will look to have partnerships with organisations, even such as UNICEF, and other health systems to be able to create this trusted partnership. They want to be accepted as a trusted partner. They'll choose organisations deliberately that are trusted by parents, professionals, and health professionals alike. And if parents trust the health professional or trust the health organisation, then they're more likely to trust the products and services that the companies are asking the health professionals to promote. So how do partnerships with health organisations help those companies achieve their goals? Sometimes they use us for intelligence gathering. They gain market advantage through information. So they get information from working with us. For example, if through partnering with an organisation that works with pregnant women and those caring for infants and young children, they can get new insights into what may appeal to women, appeal to mothers, appeal to those specific population groups. And all of this is used to help them plan their marketing activities to promote sales of their products. We know that companies use misleading or information to mislead healthcare professionals. Their failure to provide the appropriate scientific and factual information in advertisements for their products is something that we see often. Health professionals, for example, might see advertising for infant milks and specialised milk products in journals, in magazines, and at conferences, study days, etc., and particularly nowadays on websites and social media. And they may then believe what they're seeing in those adverts. However, we know that this is not strictly limited to just the scientific and factual information. This advertising does influence which products health professionals might promote, and it forms their opinions about which products might be compatible with health guidelines. So just very quickly, and David's going to go into this in much more detail than what I've said, but the take-home message I hope from today is that donations to healthcare service, including health workers and health professionals from companies selling foods for infants and young children, represent a conflict of interest and should not be allowed. That sponsorship of meetings of health professionals and scientific meetings by companies selling foods for infants and young children should not be allowed. And that it's important to be aware of how creating partnerships with formula companies endangers children's rights. So with that, I'm going to hand over to David Clark. David is a former UNICEF staff member. He was the former legal advisor for UNICEF nutrition programs in our headquarters. He's a code expert, and he's going to expand on the health professionals' role in protecting the nutrition rights of mothers and babies. I'll just stop sharing. Over to you, David.
Yes, thanks very much, Karen. I'll just wait till your screen has gone down before I share mine. Good afternoon, everybody, or from where I am, good morning, everybody. Let's see. Okay, is my screen now visible?
Yes,
In the
we can see.
presentation mode.
Yes, we
There we
can see your
go.
screen and slides.
There we go. Hold on. Okay. Okay, and I'm just going to take away this from the top. Okay, well, as I was saying, good afternoon, everybody. It's a pleasure to speak to you on this topic because it really is important to understand how important the role of the health professionals, the health workers, are in protecting the nutrition rights of mothers and babies, and that's by protecting, promoting, supporting breastfeeding, and also by ensuring that mothers, parents are protected from the influence of the baby food companies, but also ensuring that you yourselves are protected against the influence of those companies, which isn't always obvious. And I just wanted to start by flagging for you this series of papers in the Lancet, a Lancet series on breastfeeding that came out in 2023, which provide a really good insight into what is the full impact of the marketing of baby foods, baby formulas. And it looks at it from three ways. It looks how in the first paper, it looks at how the various ways in which the companies manage to undermine breastfeeding by, for example, by trying to misrepresent what is normal maturing behavior of the newborn. So, for example, it's actually perfectly normal for babies to regurgitate after they've been breastfed. That happens to about 50% of babies. It's actually normal for babies to cry for about 2 hours in a 24-hour period. That's perfectly normal maturing behavior. But the companies, they make that seem like a problem. They undermine the parents' confidence in how they are dealing with their newborn child. And they offer their products as solutions to what are in actual fact normal baby behaviors. So they offer the formula for babies with sensitive stomachs because they've been regurgitating, which we actually know is a normal behavior. Formulas for fussy babies, babies that cry, etc., etc. These are all ways of taking normal behavior, making it seem abnormal, and undermining parents' confidence, and then suggesting solutions. So the second paper looks at how the formula companies actually have created a system in which they capture the parents through advertising, marketing. They capture communities. They capture the science by, for example, sponsorship, providing research money, in which, of course, they have some control over what the outcomes is, and in policy development. And it also looks, for those of you that are interested in that kind of broader political economy aspect of it, it looks at how corporate power or the influence of these companies really affects how healthcare systems work. For example, by having created the kind of ideological public-private partnership idea where partnerships with the private sector are encouraged. And in some cases, that can be appropriate. But in the case of infant feeding, it is certainly inappropriate. So I just wanted to mention these papers for any of you who are interested in looking deeper into these aspects. It's really quite fascinating, and they're all available for downloading from the Lancet. So We're really talking about resolving conflict of interest in child nutrition. That is the influence of the formula companies on the medical establishment. And I have to say, it's most of the time the medical establishment, the medical profession is unaware that this is happening, and that is all part of the strategy. So where does this conflict of interest arise from? And we have to start, it's actually very clear as health professionals or as public health advocates, what we want to achieve is to improve health and nutrition outcomes. And the science shows us that the way to do this is to increase breastfeeding rates, both in terms of exclusivity and in terms of duration of breastfeeding. That is how we improve health and nutrition outcomes. The companies, the formula companies, on the other hand, their primary interest is to sell more products, to increase their profits and the returns to shareholders. That's how they're held responsible. Every year at the annual shareholders meetings, the shareholders want to see their profits going up. In order to do that, the companies must sell more of their breast milk substitutes. And in order to do that, they have to make sure that they reduce the number of babies who are breastfed. So you can see there is a complete conflict in our interests. We want to increase breastfeeding, they want to decrease breastfeeding and sell more of their products. And if we keep that in our minds, it means that we can look at what are the motives when these companies offer to help us. Because if they were actually really helping us increase breastfeeding, they would be harming themselves. So we have to be very skeptical about any offers from these companies to help us, to be nice to us, to take us out for lunch or whatever it is they want to do. I don't think, since you're all taking this this course and listening here, I don't really need to talk to you about what's so special about breastfeeding. It is all very well documented. But, a couple of the things I think are worth mentioning is that, apart from reducing infant mortality, respiratory infections, diarrhea, etc., there are things like the impact it has on reducing the risk of type 2 diabetes and obesity, things which are becoming a public health emergency, really, in just about every country around the world. So it's important to remember some of those other aspects that are important for us in public health. So just briefly, people have been talking about this issue for almost 100 years. And there's, people often look to this speech that was made by somebody called Cicely Williams, who was like a child health pioneer back in the early part of the last century. And she, in 1939, made a speech because she had been working in Africa. She had seen children with this, like in this photograph, and she actually coined or invented the term kwashiorkor to give a name to this type of malnutrition that you see. And it was most of the babies that appeared like this, it was because they were being incorrectly fed artificially. And what she said was misguided propaganda, meaning advertising, on infant feeding should be punished as the most criminal form of sedition. It should be a crime. And those deaths, the deaths of those babies, should be regarded as murder. She called that speech Milk and Murder. That was back in 1939. Not many people really picked up on that. And in 1968, so we're talking about the next sort of thing that we see happening, or that seems to resonate amongst historians of this issue, is that in 1968, Dr. Derek Jelliff, another person who is well known in this field for the work he did in trying to raise the alarm, he coined the phrase or invented the phrase commerciogenic malnutrition, which meant he was linking the malnutrition and the harm to the product promotion, to the commercial activities of these companies. Then, so again, those were, things that happened, but not much was being done. 1974, there was an NGO, a non-governmental organization in the United Kingdom, who made this little brochure called The Baby Killer. And it was all about how babies were dying in Africa as a result of women being persuaded to give up breastfeeding and to use feeding bottles in conditions that were totally inappropriate, and it was leading to the deaths of hundreds of thousands of babies. Now, that was in the United Kingdom. In Switzerland, which is the home of Nestle, that's where Nestle is based, some students, an NGO in Switzerland, they translated the baby killer into German, but instead of translating literally the title, The Baby Killer, they changed the title to Nestle Kills Babies. So Nestle wasn't very happy about that, and so they sued these students. Now, in actual fact, that wasn't really a smart thing for Nestle to do, because while the brochure Nestle Kills Babies was only being talked about in Switzerland, as soon as an international company sues students, it made international headlines. So in fact, it wasn't a very smart public relations thing for Nestle to do. The case went to court, and the NGO, the students, they were found guilty, but they only received a very small fine. And the judge told Nestle that they would have to re-examine their marketing tactics. Meanwhile, in the United States of America, a kind of group of nuns, they sued Bristol Myers, a big American company. Bristol Myers, they had seen what happened when Nestle went through the whole issue of going to court and the publicity, and so they decided to settle the lawsuit out of court. And in the US at that time, the US Senate held hearings chaired by Senator Edward Kennedy on the inappropriate marketing of artificial feeding in developing countries. So you can see that from 1939, all this harm was continuing, and it took until 1978, and then 1979, finally, WHO, UNICEF, the international health community, decided to have a meeting on this issue. So 40 years went by until the world started to take this issue seriously. So this meeting in 1979 led to the development of the International Code of Marketing of Breast Milk Substitutes that was adopted by the World Health Assembly in 1981. And it is a recommendation to all governments to adopt national regulations. So the World Health Assembly, of which all of our ministers of health are members, they meet every year, and they come up with these global public health policy recommendations. So although the code was adopted back in 1981, it's updated regularly by subsequent resolutions of the World Health Assembly so that it can deal with new marketing tactics or new products. I mean, new infant feeding products have been developed since the code was adopted in 1981, but they are covered by the code. So basically, the code tries to protect women from misinformation or by prohibiting all advertising or any other forms of promotion of breast milk substitutes, feeding bottles, and teats. It also prohibits the use of the healthcare system to promote breast milk substitutes. And in doing that, it tries to protect health workers from the influence of the formula companies, which, remember, their only interest is to improve their sales, and they often try and use healthcare systems and healthcare workers to do that. And it also requires, and this is important because one of the things we really want to ensure is that parents and mothers, women in particular, can make an informed decision about how they want to feed their babies. And the only way they can do that is if they have the proper science-based information on what is best for them and their babies. We don't want them to be making decisions on the basis of an advert or an advert that tells them that infant formula is as good as or better than breastfeeding, or some sample that they've been given, or some gift they've been given, or advice that's incorrectly given by a health worker. So this is just a quick graph because it kind of shows that in countries that adopt good code regulations, it has a huge impact on the sales of infant formula. So the countries, if we look at China, and this goes from 2008 to 2018, and look at the increase in the sales of infant formula in China, they just go up and up and up, meaning less and less babies are breastfed. If we also look at Indonesia, the sales of infant formula go up, 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 up. Now, the reason, or one of the reasons for that, maybe one of the main reasons, is that in China and Indonesia, they do not have good code regulations. They do not regulate the marketing of formulas. And indeed, the companies have quite an influence in those countries. In India, we can see down here the sales are very low and continue to be low. And in the Philippines, they've also been fairly stagnant over these years. India and the Philippines have good code regulations that prevent the advertising, that regulate the labeling, that regulate the impact or the influence that formula companies can have in the healthcare system. So it kind of shows that it does work. If you have good code regulation, it does work. So we want to look briefly at how does Ukraine score in code implementation. And this is from the 2024 Marketing of Breast Milk Substitute Status Report, which is put together by WHO, UNICEF, and the International Baby Food Action Network, IPFAN. And here we can see that countries can score up to 100 points in terms of the scope of their regulations. That means what products are covered by the regulations, whether there's good monitoring and enforcement. Remember, governments should ensure that parents get good information about infant feeding. So there's a score for the level of information that's received or how it's regulated. Promotion to the general public, promotion in the healthcare system, to what extent the country allows engagement with health workers in the healthcare system, and labeling. So overall, Ukraine scores 34 out of 100, which isn't a great score. I have to say, in Europe, the scores tend to be lower, and in Western Europe, in EU countries, that's because of the influence of the baby food industry within the EU political system. But if we look at where Ukraine scores badly, they get 0 points for information and education materials. So there's not really a good indication as to what information parents should be receiving. or an obligation on government to make sure that they get that. Promotion in healthcare facilities scores 0 out of 10. And the engagement between the companies and the healthcare system receives 2 out of 15. So we can see that certainly it's a country in which the healthcare system and health workers are very vulnerable to the influence of the formula companies. And if you have a country where that's happening, that means that the companies think, oh, good, there's a loophole, there's a weakness. That's where we will concentrate our spending, our efforts. So there is a real need to address conflict of interest in the country. So just to look quickly at some of the ways that the companies actually manipulate and mislead parents. And one of them is in making health and nutrition claims. And Karen alluded to this. She spoke about that a little bit. And I chose this example, which comes from the United States. And I chose it because the United States does not have good regulation in place. But even in the United States, the Federal Trade Commission realized that this was just ridiculous. This is for the Gerber generation, which Gerber is a formula brand. And this advertisement says, I love mummy's eyes, not her allergies. So what they're really claiming is if you want your baby to be healthy and not have allergies, you should use Gerber products, because if the baby inherits the mother's beautiful eyes, going to inherit the mother's allergies, etc. No scientific basis for that claim, purely advertising. But again, remember, we're trying to play on the parents' concerns, their worries, and present them with a solution. So they were not allowed to get away with this, and they had to stop this advertisement. And the World Health Assembly has also called on governments to prohibit all health and nutrition claims on foods for infants and young children. Digital marketing is something that happens now. This is something that I managed to find from Ukraine. It is a bit old, but it's from the last IPFAN international report on violations. So going well, this is Danone in Ukraine, and this thing popped up on a smartphone when somebody is trying to, search for something. And again, this is claiming that healthy digestion for the first days, again, promising something miraculous in the first days, which is, I mean, it's clearly promotion, false information. So just an example. Now, when it comes to the human rights aspect, I often refer back to, I was lucky enough to be working at UNICEF when this man, Stephen Lewis, was the deputy executive director. And he stood up and as part of a speech he was making at the World Health Assembly, or I think it was the Codex Alimentarius in Geneva, he said that those who make claims about infant formula that intentionally undermines women's confidence in breastfeeding, which is what we've seen they do, they are not to be regarded as clever entrepreneurs just doing their job, but as human rights violators of the worst sort. Every time a company persuades a woman or scares her into giving up breastfeeding and using formula, they are violating that child's right to the highest attainable standard of health and the woman's right to make an informed choice. So they really are violating the rights of both the mother and the baby. One of the other things that companies do not do or don't want us to do, and that is to disclose the risks of artificial feeding, the risks of using formula. And one of those risks is around the fact, and I'd been working for a few years in this field until I learned that powdered infant formulas are not sterile products. I just assumed something that we would buy to give to a newborn baby must be sterile, but it's not possible to guarantee that a powdered formula is sterile when it comes out of the factory, where it can have been contaminated with heat-resistant pathogens and bacteria such as Chronobacter sakazaki. Um, and so once this became known, the FDA in the United States actually put out a warning several years ago to all the medical professions saying that this exists and that certainly you should never use powdered infant formulas for premature babies or babies with compromised immune system. I mean, I would argue that every newborn baby has a compromised immune system because they really require the antibodies from their mother's milk to help them get through their early days and weeks. So in 2005, the World Health Assembly called on governments to inform that powdered infant formula may contain pathogenic or microorganisms and must be prepared and used appropriately, and to ensure explicit warnings on packaging. Now, I don't know if you go out and have a look at infant formulas on the shelf, powdered infant formulas on the shelf in Ukraine, if you will find any such warning. I do not believe that you will, because the companies have resisted this. 2007, FAO, the Food and Agriculture Organization, and WHO came up with a series of instructions or guidelines for minimizing the risk of contamination of these products. In general, a dramatic reduction in risk is achieved when powdered infant formula is reconstituted with water that is no less than 70 degrees centigrade. Risk is controlled by minimizing the time from preparation to consumption. So you need to use hot, very hot water to minimize that. However, last October, I've done this several times, but last October I went onto the Nestle website for Canada, and it instructs parents to use lukewarm water in complete defiance of the recommendations guidelines from WHO. Bring water to a rolling boil for at least 2 minutes and let it cool to lukewarm or body temperature before using. So the companies don't want to raise the awareness of this. They don't want to sort of admit that there's a problem. And this is extremely serious. And in the United States, there have been illnesses and death regarding infant formula that was found to have found to have these Chronobacter sakazaki or salmonella in infants who had consumed powdered infant formula manufactured at this facility. So it is real. The authorities in the US were slow to react. The FDA had learned of the suspected infant formula illness 4 months before they recalled the formula. And it has gone to court in the United States, and there was a $60 million jury verdict in the first trial, holding manufacturers accountable for causing necrotizing and enterocolitis. Is that right? You doctors will know. In premature infants, another award of $495 million in St. Louis. Again, with this thing. So, and there are other lawsuits awaiting litigation in state and federal courts throughout the US. So it is real, but it's something that the companies are not prepared to warn parents of. I think that it's every consumer, every parent's right to know that when they buy a product, there is a risk of it harming the baby if it's not prepared properly. So When we talk about how the companies use or manipulate the health facilities or the health system or health workers, it's called, excuse me, we can refer to as endorsement by association. Endorsement by association is the fact that the companies really want their name, their brand, their products in the healthcare system, preferably on a doctor's desk, a calendar on his wall or her wall, um, something that the parents, the mother in the hospital visiting the doctor or the nurse will think, oh, oh, I see that company's name. That must be a great company. The hospital must really think they're great. They must be endorsing. That's endorsement by association. It's also referred to as manipulation by assistance. And that is when the formula company comes to the hospital, say, well, we'll help you. You know, what do you need? You need some formula. You need some incubators. Oh, maybe we can take you out for lunch. This is manipulation by assistance. And often the person or persons targeted don't realize that they are being manipulated. Now, most of you will be, yeah, I think there'll be very few people around today who can remember this, but it is really important for companies and products to get the endorsement of the medical profession. Now, back in the mid last century, they used doctors to promote cigarettes. Here's some adverts from the time. Luckies are less irritating, says the physicians. More doctors smoke Camels than any other cigarette. I mean, that would never happen today because we think, well, you shouldn't be promoting products that are harmful. And in certain cases, infant formula is harmful, but they really want to get the endorsement. Again, health workers were used, or the image of health workers and health systems were used to promote Coca-Cola, served in leading hospitals, or Canada Dry, ginger ale. She can have all the Canada Dry she wants. So again, trying to have this endorsement by the healthcare system. It really works. It really makes people want to buy more of a product, even when it's not a healthy product. And of course, breast milk substitutes. So using these images of the nurse feeding the baby. But this is quite concerning because these are advertisements that are suggesting that it's okay to feed babies, young babies, condensed milk. My doctor said carnation. Absolutely ridiculous. I mean, who in their right mind today would suggest that any mother feeds her baby with condensed, evaporated milk? Nowadays, the endorsements are more subtle, but they're still there. And this is one from Russia from a while back. But the symbol on the packages says recommended by the Russian Pediatric Association. Again, great. Parents see this. Oh, the Pediatric Association think this stuff is good. It must be good. And no doubt in return, the Pediatric Association would have received money for their association or sponsorship for their conferences or something like that. And again, this endorsement by association. I've been to several countries where the white coats for the doctors, for the pediatricians, provided by the company with the logo of the formula company on it, or growth charts, or just other things to brighten up a drab hospital with the company logo, etc. Again, this one is actually both of these things, isn't it? It's manipulation by assistance, and the other one as well, because it's influencing the doctor, but it's also in turn influencing the patient, the consumer. So, and this is something I've noticed in all the years that I've been doing workshops and things like that, is that people who have received sponsorship support from formula companies become very uncomfortable when I speak badly of them. They become very defensive. And that's because sponsorship, by its very nature, creates a conflict of interest. Whether it's the form of a gift, or meals, help with conference expenses, it creates a sense of obligation and a need to reciprocate in some way. We always, when somebody gives us a gift, we feel grateful and we want to be nice in return to that person. The gift relationship thus influences our attitude to the company and its products and lead us to an unconscious unwillingness to think or speak ill of them. And it works. I mean, this is research that's been done into this. So we know why it's called manipulation by assistance. The code was very weak on sponsorship. Remember, I said the code was adopted in 1981, but we've had resolutions since then. So under the code, it was okay for companies to provide fellowship study tours as long as it was disclosed by the recipient. So a doctor or a nurse would have to report that to the institution they worked for, and the company would also have to report it. But clearly, it led to a lot of conflicts of interest. And it's in 1981, perhaps people weren't so aware of the impact of conflict of interest. And since then, people became very aware of the negative impact it has on infant young child feeding. So finally, in 2016, the WHO guidance on inappropriate promotion of foods for infants and young children, excuse me, was adopted by the World Health Assembly. And it says that companies that market foods for infants and young children should not create conflicts of interest in health facilities or throughout health systems. Health workers, health systems, health professional associations, and non-governmental organizations should likewise avoid such conflict of interest. Such companies or their representatives should not. And then there's a list of the things that companies should not do. So they shouldn't be providing free products, samples, or reduced price foods for infants through health workers or health facilities. They shouldn't donate or distribute equipment or services to health facilities. They should not give gifts or any incentives to healthcare staff. They shouldn't use health facilities to host events, contests, or campaigns. They shouldn't provide any gift or coupons to parents. They shouldn't directly or indirectly provide education to parents and other caregivers on infant and young child feeding. Again, we don't want a company whose main interest is to sell more of a product telling parents how they should feed their babies, because they're certainly not going to encourage breastfeeding. That would be to their detriment. They can provide they can only provide information to health workers that is scientific and factual. And most importantly, they cannot sponsor meetings of health professionals and scientific meetings. And again, health workers, health associations, they are not allowed to accept any of these things that I have just listed. So there is, I think, as I mentioned, there's a growing awareness of the harm of sponsorship, of the harms of conflict of interest. And I use this one from the Scottish Public Health Network because I'm from Scotland, so I'm very proud of my colleagues in Scotland. When they said, in view of your decision, this was to the hosts of a conference, in view of your decision, some would suggest error in accepting sponsorship from a transnational confectionery and breast milk substitute manufacturer. I think we know which company that is. We will be recommending to colleagues that they should not attend or participate in your conference. So this is a public health network saying, no, we're not coming because you are sponsored by a company that violates the code, that does harm to children, and this is, for us, is a conflict of interest. This is another case where the Royal College of Pediatrics and Child Health in the United Kingdom, the NGOs got together and launched a campaign because this company was sorry, not this company. This college, the Royal College, was hosting an international conference in Egypt, and it was to be sponsored by baby food companies Nestle, Danone, Abbott. So this got picked up by the press and by the international press, and the UK's largest body of paediatricians had to back down and say that they would no longer take money from baby formula companies. So it had an impact. As I say, people are much more aware of it, of the harms, and they're much more monitoring the situation to and pointing out where this kind of conflict of interest is happening. I just wanted to finish up by saying there's a very useful resource source at the Global Breastfeeding Collective. You can see the website for that, their Breastfeeding Advocacy Toolkit. And there's a whole series of publications on the code available there for free to download. I just wanted to highlight 3 of them that might be, if you find this topic interesting. First one, what I should know about the code, and this is a nice, simple, user-friendly guide to how the code should be implemented and how to identify violations. Then we have this one here, protecting infant and young child nutrition from industry interference and conflicts of interest. So that gives a little more detail of what I've been talking about today and what you should know about and what you're able to do to protect yourselves and to protect parents and babies. And then this one here is useful if any of you find yourselves getting into an argument with industry, because they will argue that, for example, oh, we're only trying to achieve what you're achieving. We want the best for children, etc. So we have this publication here, which can highlight some of the arguments the industry says, and it can provide you with the counter arguments that debunk the things, the false things that the companies are saying about their products, their advertising, and about the code. So I'm going to finish with that, and I'm very happy to take any questions that you might have.
David, we indeed have some questions for you.
Sure.
Just I'm waiting until I will appear at the screen, and Karan, if she is, yes, Karan is still here. So we will, all 3 of us, appear on the screen. So the question comes from Lina Barska, who is one of the leading specialists in Ukraine on breastfeeding and trained a lot of specialists in Ukraine. So I will read it in Ukrainian, and translators will go ahead with the translation for you and Karan. Як ви відноситесь до позиції певних організацій трошки виконувати кодекс, але все ж таки брати гроші для конференцій, але обмежувати кампанії в їх діях?
I'm afraid there's it's very difficult to comply with the code a little bit. You either comply with it or you don't. And if you don't, the code is based on evidence-based research into how the companies influence consumer behavior or the behavior of the medical profession. So allowing organizations to take money from the companies or to but to try and limit then the influence that they have. Again, what I described in that social science research is that you're still allowing that you're still allowing that relationship to take place, the donor-recipient relationship, which has an impact on the behavior of or the way the participants, just by seeing the company name there or whatever, it's the endorsement by association sort of thing, which actually influences the way people think about the company and its products. So I'm afraid it's I would say specifically with this part of the code, we really need to follow it completely, because otherwise we are undermining. Remember, why is this company prepared to give money for this conference? They're not going to do it if they're not going to get anything back, because they have to increase their profits. And clearly they believe that by sponsoring, by supporting, that they're going to get something out of it. And of course they are. That's what the science tells us. So I'm a great believer in, if you want to protect babies, if you want to protect mothers, if you want to protect healthcare workers, you have to comply with the code. It's not just put there as an obstacle to companies. It's put there for a very good reason, and that is to protect, promote, and support breastfeeding.
Є ще в нас питання від пана Отто Стойка. Чи гарна стратегія вимагати продаж сумішей тільки через аптеки?
The code is actually designed, it's not designed to try and stop people using breast milk substitutes. If it's discussed with a health worker and they decide that's the best way for them to do it. So the code isn't about trying to restrict access to formula when it's needed. It is to it's to stop this promotion, this false information, this trying to persuade people. So, for example, a good part of the code is about the labeling of the product, so that the labeling's not used, so that when it's on a supermarket shelf, the labeling, it doesn't make somebody attracted to the product, with a picture of a healthy baby on it, or a bunny rabbit, or this sort of thing. So it's not about the sale of the product. I only know of one country where they tried to sell it only through the pharmacy, but I think the formula companies might be happy if formula was restricted to pharmacy, because when things are sold in pharmacy, it gives them the idea that these are medical, or that they're special, that they are, So, for example, a number of years ago in the EU, in Italy, the companies were found guilty of antitrust behavior. That's when the companies get together and they devise, even though they're supposed to be in competition, they actually get together in secret and they devise a strategy that's going to benefit them all. Usually it harms the consumer because they're trying to, again, maximize their profits. So in Italy, the companies decided, we will only sell our products through pharmacies. And by doing that, they were able to increase the price of the formula in Italy compared with anywhere else, because people think if you're buying something in the pharmacy, it's a medicine, it might be more expensive, etc. So I don't believe that restricting the sale of formula to pharmacies is necessarily a good strategy. And I don't know of any countries where it has worked.
Є в нас наступне питання від пані Єлізавети Стельмащук. Чи є порушення принципу надання правдивої інформації, називання певних лінійок сумішей лікувальними?
I think that in certain cases there's even a codex standards of formula for special medical purposes. So there are some very rare conditions that require a very special formula, and I guess that would be that kind of special formula would be okay to say that it is a treatment for the specific condition that it is. But there shouldn't be, for example, a formula that they call anti-reflux, for babies that regurgitate. That should not be called a treatment for regurgitation, because I think that would constitute a health claim, which is not allowed. As I say, there's a very limited category of formulas for special medical purposes. They're regulated under Codex Alimentarius, but for the main formulas that are regular formulas that comply with the Codex Alimentarius standards for infant formula, for follow-up formula, and for formulas for older children, those should not be called treatments. That would be a violation. That would be suggesting some kind of health claim.
Є побажання від пані Ліни Барської до перекладачів, щоб вони казали слово «формула» замість слова «міксис», що є прямим перекладом суміші. Тобто ви замість слова «міксис» скажете «формула». Дякую, пані Ліна.
I'm not receiving any translation at the moment.
David, can you say it once again?
Okay, sorry. Yeah. Okay.
Пані Марина Гуза питає, як зрозуміти, що суміш по складу більше прийнята для прийому дитини? Більш прийнятна для прийому дитини.
Yeah. Okay. This is I think the companies very often try to persuade us that these are hugely advanced scientific advances that are closer to breast milk, etc. In actual fact, all formulas, in order to be on sale in the market, they comply with Codex Alimentarius standards. So basically, they all comply with a certain standard, and every formula that complies with that standard is safe and appropriate if prepared and fed safely as a substitute for breast, or to be used in place of breast milk. So what the companies try to do as a marketing strategy is that they have for example, their regular formula, and then they have their gold formula, and they charge a lot more for the gold one, and they say they've put in more of this, more of that. They've put in DHA, or they've put in, oh goodness knows, what you call the probiotics, or they've put in this. There's no evidence to suggest that that actually has any benefit for the baby. For example, there's been analysis done that this is really just a marketing ploy to try and get wealthier parents to spend more money on a product that must in any case comply with the standards of the Codex Alimentarius, and the formulas do comply with them. So anything that suggests one formula is better or closer to breast milk, which they're not allowed to say actually they shouldn't be making these claims on the formulas in any case, but that is purely marketing. Every formula is fit for purpose and complies with the Codex Alimentarius standards.
Шановні учасники, бачу, що є в когось піднята рука. Ми зазвичай задаємо всі питання в чатику, але якщо, наприклад, ви за кермом і немає такої можливості, то, будь ласка, з голосу зараз задайте своє питання, а перекладачі за вами перекладуть. Якщо такий учасник є, будь ласка, включіть мікрофон і задавайте своє питання зараз. Якщо ні, то тоді продовжимо за питаннями в чатику. Угу. Зараз немає рук, тобто, мабуть, вже людина написала своє питання. Тому питання від мене. Девід, уявімо собі, що ви керівник великого перинатального центру. І ви знаєте, що деякі ваші співробітники беруть відкати від виробників. І ви хочете це змінити. Що б ви робили? Взагалі, в перинатальному центрі, щоб там не було ні скритої, ні відкритої реклами сумішей.
Okay. I think, first of all, Katya, the issue is that a lot of health workers are not aware of what's happening. That's why it's called manipulation by assistance. People are being manipulated without. So I don't think that we should assume that these are bad people or bad health professionals. They are maybe unaware of this. So I think the first thing I would do would be to show them the recording of this webinar, maybe, so that they become aware of what's, of why this is harmful, of why it's not helpful, and to let them know that they're being manipulated. And then once you've done that, it can be part of the policy of the institution that this should not happen. And so anyone who then, after they know what their responsibilities are, who continues to do that, then in these circumstances they should be called out on that, and perhaps there should be some type of sanction. But we need first of all to inform people, because I mean, in my experience, most of the health workers I've ever come up against really want to do the best for the mothers and the babies, and often they won't realize that what they're doing is harmful. So that would be my suggestion.
І питання до обох Карен і Девіда. Я трішки парафразую питання, яке задала пані Ліна Барська, про можливість рапортувати про порушення. Як це побудовано в різних країнах? Хто кому рапортує про таке порушення, наприклад, в пологовому будинку або в дитячій лікарні?
Yeah, in different places they have different forms of reporting. I think one of the ways that the code is applied in healthcare systems is through the Baby Friendly Hospital Initiative, where it is actually part of the 10 steps. And so you will find that code compliance is greater because it's part of the assessment and the reassessment and part of the training of the health workers. But each country has to look individually at how these things are happening. Governments can set up a monitoring system in which and there's guidance for this from WHO and UNICEF. It's called NetCode, and it has protocols that includes protocols for carrying out monitoring in health facilities, which would include questionnaires with healthcare workers, but also with mothers in the facility so that they can get an idea of where the mother is getting her information from, etc. So there are certainly ways to do it. And we could help you look to countries where they're doing it successfully. But it is sometimes it's easier to find violations in the public places, on the television, in the internet sometimes, than it is within the healthcare system. But again, it all comes down to the training orientation of staff in healthcare systems, about their knowledge, yeah, so hopefully this webinar is a start to achieving that.
Я перевіряю, чи є в нас ще питання. Питань додаткових не бачу. І так ми з вами пробили в цьому зумі 1 годину і 10 хвилин. І я, може, попрошу Девіда, а потім Карен щось сказати на кінець цього вебінару. Чим би ви хотіли завершити?
Shall I go and give Karen the last word? Yeah. No, I was very pleased to see that there was a good turnout for this lecture. I hope that I've managed to at least make you think a little bit about, to question why would these companies want to help us? What are they going to get out of it? To realize that there is a fundamental conflict in our interests. We want to improve breastfeeding rates. They want to sell more product and reduce breastfeeding rates. And we have to think about that whenever we're approached by them. I hope you realize that what they've been trying to do through the code is to try and also protect you from being vulnerable and manipulated. Sometimes it's difficult to say no to a pushy company representative when they come, but if you know that under the code they are not allowed to do that, it gives you some authority to say, no, I'm sorry, this isn't appropriate, this is not allowed. So anyway, I wish you all the best in the work that you're doing, and it's been a pleasure to speak to you today.
Зараз ми спробуємо розм'ютити Карен, якщо оператори спробують, бо в неї не працює. Будь ласка, спробуйте розм'ютити Карен.
Okay,
Yes.
am I audible? Okay, sorry, because I was not able to unmute through the whole question and answer session. So, just to reiterate what David has just said, I hope that this session has empowered you to feel more confident to really stand up to industry pressure if and when you experience that, because it's likely that within your careers that will happen, and that you have now a sense of knowledge of the code and what it says and what it does and how you can help in supporting the implementation and enforcement of that as well, and as part of your responsibility. So I think that if there are other questions or follow-up questions you may have after this, I'm sure that the colleagues at UNICEF Ukraine office would be more than happy to assist with the support from regional office. So we look forward to be able to continue supporting you. Thank you.
Дуже дякуємо, Карен і Девіду. Це наш перший вебінар. Ми сподіваємося, що в нас будуть ще. І всім дуже дякуємо, хто був на цьому зумі. Вас, до речі, було дуже багато. Вас було десь до 248 людей максимум разом. І ми вам дуже дякуємо, що ви приділяєте увагу цій темі і навчаєтесь на нашому курсі з грудного вигодовування. Запис семінару цього буде, вже є українська версія на каналі доктора Булавінова в Ютубі. І також англійську версію ми викладемо, може, завтра вранці.